Good morning, good afternoon, depending on where you're calling in from today, everyone. I'm Tim Cobeson with the Alliance for Strong Families and Communities, and before we get started, I'm going to quickly touch on a few process-related notes. Please note that all phone lines will be muted throughout this webinar to minimize any disruption. However, please feel free to submit questions via the chat box located on your screen at any point during the presentation. Questions will be addressed at the end of the webinar, and with that, I'd like to turn it over to the President and CEO of the Alliance, Susan Dreyfus.
Thanks, Tim. Hi, everybody. Good morning. I hope you're all having a great week. I want to welcome you all to this call and give you a few opening remarks, and then we'll go in to the content here. First of all, the Alliance for Strong Families and Communities is an over 100-year-old national association. We are the product of several mergers over that time. That is now known as the Alliance for Strong Families and Communities. We have a national network of over 400 community-based human service organizations across America of all shapes, sizes, rural, urban, suburban America, and in all states. We are an organization that is focused on helping organizations to be excellent in what they do, and we do that through giving them the best in terms of knowledge, networking, and the solutions that they can use in today's environment. We also pride ourselves on being disruptive in the field and sector, taking on the tough issues, and looking at the trends and issues influencing our field and sector and getting in front of them. We are also very proud of our partnership with the American Public Human Services Association. Clearly, our two sectors are interdependent upon one another, and it's very important that we work in a deeper and lasting partnership with each other to make sure we're getting the very best results that we can in our health and human services delivery system in America and innovating together for better results. We're here today to share the findings and recommendations of a groundbreaking new study commissioned by the Alliance and the American Public Human Services Association and carried out by our partners at Oliver Wyman and Sea Change Capital Partners. This study is indeed unique and groundbreaking in both the breadth and depth of the study into the financial health of nonprofit human service community-based organizations across our country and the implications that this has for the role they play in the larger health and human services ecosystem overall and the ability for us to achieve the results we all want: improved safety, mental and physical health, improved education success, people's ability to succeed economically, and to have mobility in their economic circumstances. Our report describes the role of human services in the national economy and in society. It outlines the risks the sector is facing and makes recommendations for human services, community-based organizations, our government partners, and philanthropic partners to ensure the sector's health, sustainability, and long-term effectiveness. It is essential to note the value of partnering with Oliver Wyman for this study. As a global leader in management consulting with a presence in nearly 30 countries, Dylan Roberts and his team bring deep specialized expertise in strategy, operations, risk management, and organization transformation. Their many contributions to this report include generous in-kind support for this project, which are both notable and deeply appreciated. The development of this report and its recommendations would not have been possible without our National Advisory Council, whose members were carefully selected from nonprofit human services, government, the private sector, and academia. I wish to give them both recognition and deep appreciation as we join forces across fields and sectors to make sure our human services system truly can reach its fullest potential. The funding for this project was provided by the Kresge Foundation and the Ballmer Group, with additional support from the Health Foundation for Western and Central New York, Mutual of America, Selective Insurance Company of America, and the U.S. Chamber of Commerce. I wish to thank them for their understanding of the need for this report and the importance to move the recommendations to action. I also want to recognize the Alliance Board of Directors who have supported this important work, our board chair, Molly Greenman, who is president and CEO of the Family Partnership in Minneapolis. We hope many more people will share this report in their communities and join us in leadership to bring to life the imperative of ensuring human service community-based organizations are able to truly be at their very best as critical partners in making sure all people in America can live their lives to their fullest potential. It's now my pleasure to introduce to you a dear colleague, friend, and partner in this endeavor, Tracy Waring-Evans, who is the CEO of the American Public Human Services Association, a bipartisan nonprofit membership organization representing the nation's top government human service executives. Building on the expertise and experience of the American Public Human Services Association's membership, just as we do here at the Alliance, Tracy is leading the association's efforts to drive transformation of the health and human services system to a more sustainable path that is both effective and cost efficient. Tracy has a long history in high-level policy development and public administration. Prior to joining APHSA, she served as senior advisor to Department of Homeland Security Secretary Janet Napolitano, and before that, Tracy served as the director of the Arizona Department of Economic Security, a large and integrated human service agency. It is my pleasure to introduce to you Tracy Waring-Evans.
Well, thank you, Susan, and welcome everyone to this webinar. I would just like to extend my appreciation to everyone who helped put this important study together. You'll hear about it shortly and why we think it's so important for the field of human services, but also for all of our families and communities. And we're deeply appreciative of the partnership we have with the Alliance for Strong Families and Communities and the work that came through Oliver Wyman and all of our partners that supported funding this effort. At APHSA, the American Public Human Services Association, we represent public sector leaders of health and human service agencies who are working to advance the well-being of children and families so that all of our communities can thrive. Our members work at state, county, and city levels with and through the community-based organizations to provide services across the life cycle, everything from early childhood development to employment supports to supports for older adults. You'll hear us probably throughout this webinar speak to the larger human services ecosystem, and by that we mean the system under which the community-based organizations, government agencies, and the philanthropic community collectively administer and deliver these services. It's my distinct pleasure now to introduce Dylan Roberts, who is a partner in Oliver Wyman's Finance and Risk and Strategic IT and Operations practices in the Americas. Since joining the original Oliver Wyman and Company in 1989, Dylan has consulted on a wide range of strategy, organizational design, and risk management issues with universal banks, investment banks, and insurers in North America, Europe, and Asia. His area of focus is finance and risk organizational design, governance, and compliance. And I can tell you that having access to his expertise and that of his team and his experience through this national imperative work has been absolutely invaluable to us. So with that, I'm going to turn it over to Dylan to share the findings and recommendations from the report. Please note that we'll have an opportunity for questions at the end of the presentation. Dylan?
Thank you very much, Tracy, and thank you also to all the attendees of today's call. It really has been an honor and a pleasure for Oliver Wyman to work on this study, and we really appreciate having the opportunity to talk to you about it today, and we appreciate your interest in learning more about our findings and recommendations. I want to start by giving you a sense of what we actually did. We worked for about 9 months on the study from last spring through December, and we crunched a ton of financial information about human services CBOs. We downloaded over 200,000 tax filings, 990 tax filings, which covered multiple years associated with 45,000 unique CBOs. So that's a very robust and comprehensive data set that we were working with for financial information. We also surveyed and spoke with over 200 leaders in the human services ecosystem, defined broadly, as Tracy described. So that included both executive directors and board members of CBOs, as well as heads of public agencies, individuals within philanthropic organizations, academics, and so on. So it was a broad group of participants with a very diverse set of perspectives. And before we get into the findings and describing the themes of the study to you, we wanted to acknowledge that a lot of the themes and recommendations will be familiar to those of you who have been involved in human services for years. We did find that many of the issues that we described, while familiar, are still present and important, and in some ways are getting worse. And so we wanted to recover those issues in as much depth as possible. That said, if you want to focus on what's new about this study, I would again highlight two of the points I just made in describing our work effort. And those are, first, that the financial analysis we did for this study was very deep and comprehensive. There are a ton of opinions and perspectives about CBO's financial status out there, but the observations in this report are supported by a very deep fact base as well. And secondly, I wanted to highlight again the fact that this study brought together lots of different groups, including those who often have opposing views of the issues facing human services CBOs. And we wanted to acknowledge that it's easy, and it happens, that CBOs get together and talk about all the things that government should do differently. And on the flip side, government agencies get together and talk among themselves about all the things that CBOs ought to do differently. And those discussions are maybe cathartic, but in some cases they're really not that productive, because we really do think that solutions are going to require a shared view of success and consensus on what needs to change across all of those organizations and kinds of organizations. And we think one of the credits to everyone involved in this study is that everyone involved worked hard to bridge those divides and to work together to think about solutions and required changes on both sides, both CBOs and government agencies and elsewhere. And we think that might not be completely unique, but it is a little unusual and distinctive, and it's ultimately been very valuable and will be very valuable to achieving the desired outcomes going forward. So with that context, I will flip forward, and we wanted to take a moment to set context and really highlight on this slide how large, complex, and important human services CBOs are. So this chart gives you an overview of how CBOs are funded. It shows you the major players involved in the funding and also how the financials flow. In the thick print report that we produced as part of this study, there's more detail starting around page 19 on this chart, but we wanted to call out a couple things in this webinar. First is at the center of the graphic, in the darker blue circle, we have the human services CBOs themselves. There are 218,000 of them by our count, and that's a huge number, which we think is noteworthy in and of itself. We also wanted to, in focusing on that number of 218,000, we wanted to emphasize how tremendous the spread is within that 218,000 in terms of size and complexity of organizations. Public opinion often thinks about CBOs as small volunteer-driven organizations, as charities, and there are a lot of those. 80% of human services CBOs have annual budgets less than $500,000. But it's worth noting that the largest 3% of those CBOs, so roughly a little over 6,000 organizations, account for 50% of the sector's total service provision. And these are organizations with budgets in excess of $10 million. So they're very large, they're complex operating organizations, and we think it's really important to acknowledge that fact and to note that a simplistic view of CBOs as small volunteer organizations really understates the complexity and size of at least a small number of large CBOs. We also think that view of CBOs as charities and volunteer organizations reinforces misbeliefs and misperceptions about CBOs' funding. Namely, there's a common view among members of the general public that CBOs are mostly funded by donations, and they're not. As this chart shows, roughly 3/4 of their funding comes in the form of contractual revenue, which is earned by providing services on behalf of public agencies, and it's actually paid as revenue from those agencies to the CBOs. So in effect, CBOs are large and important government contractors. And as the chart shows, the government entities spend up to $150 billion on services that the human services provide. And if you add in additional sources of funding for the CBOs, like philanthropic funding and investment income and the like, the total amount of funding that they are spending to provide services, so the value of those services that are being provided out, is more like $200 billion. So that's obviously a big number. How can we think about that? How important is that activity to our economy? And we wanted to give you a couple of reference points to contextualize that. $200 billion is about the same as the annual revenue of the U.S. airline industry. It's about a third larger than the revenues for the entire accounting and tax prep sector. So we all have intuitive beliefs and understanding that those are big industries, big and important industries, and we're talking about a number that is the same size or larger. So it's a very important driver of economic activity. It's also worth reflecting on what happens to that $200 billion that gets spent by the CBOs. A lot of it gets paid out in salaries to their employees, to counselors, to social workers, and the like. A lot of it also gets spent as rent, gets paid out to landlords, as payments for supplies, and so forth. So that money flows out into the communities that the CBOs operate in. It then gets respent on other things, and so there's a multiplier effect. And it really is a very important stream of economic activity and driver of additional economic activity in those communities. We don't want to overemphasize size, though, as the only measure of importance. So let's also spend a little time discussing how important these services are to the individuals and communities that receive them. And on the right-hand side of the page, we've noted that these services flow out to individuals, families, and communities as a whole. And there's some amazing statistics associated with who benefits from these services. Overall, about 1 in 5 Americans receive critical human services from CBOs each year. And to give you some specific numbers, 47 million Americans, huge number, rely on food banks. If you look at the foster care system, about 750,000 children pass through that system each year. So 750,000 is obviously a lot less than 47 million, but when you think of how incredibly important that system is to those kids and what a huge impact it has on their future lives and their future productivity, it's a big, big deal. Another interesting statistic, roughly 3 million Americans are receiving mental health treatments from CBOs at any point in time. And those are obviously just kind of specific data points. There are lots and lots of data points associated with all the different kinds of services that human services CBOs provide, and we just want to make the point that they touch a huge number of Americans, and they are very critical to the well-being of those Americans. Which brings us to the next point that we want to cover, which is what are CBOs' impact on economy and on our economy and on society more broadly. And we want to put a stake in the ground to argue that there's an opportunity for CBOs to have an even greater and more transformational impact above and beyond what we've just described. So the points on this slide are covered in greater depth beginning in page 24 of the written report, but a couple points we wanted to make here. First is that in the future, human services CBOs are likely to have a much greater impact simply because the demands being placed on them are going up. Demand is growing quite strongly. And if you think about things like the opioid crisis, income inequality, and frankly just the aging of America, all of those things are driving increased need for human services. Some, like the opioid crisis, hopefully will be turned around and addressed. Others, like the aging of America, are going to happen for a while, no matter what anybody does. And so there will be growing need and demand for CBO's services. So what happens if those those growing needs are in fact met effectively? On the right-hand side of the page, we've said it will really position communities to meet their full potential. And what we mean by that is communities that will be healthier, and they'll also be more productive. Their citizens are going to be more likely to be employed, more employable, and more likely to be working productively. And so what happens when you have communities that are healthier and also more productive? You really create an incredibly exciting virtuous cycle. Healthy communities are going to need less healthcare interventions. Obviously, their populations are going to still need health care and they're going to need preventative care, but they're less likely to require, for instance, expensive emergency hospitalizations. And when they're productively employed, they're also less likely to exhibit behaviors that are potentially going to lead to legal problems and drive spending in the judicial and correction systems. So the argument that we're making is that correctly done, investment in human services CBOs offers society a way of addressing two very expensive problems which have proved very challenging to address. One is healthcare spending. We spend more money than any other developed nation on healthcare today, but we have worse health outcomes. And the second is spending on the correction system. We spend astronomical sums as a society on corrections, in part because relative to other countries, a greater portion of our population is incarcerated. And that's what we really see as the potential for human services CBOs, to break those cycles, to make communities healthier and more productive over time, and in doing so, to allow us to address these big pools of spending for healthcare and corrections that really are a drag on the economy today. And we just wanted to underscore on this next page again the nature of the relationship between human services and healthcare. And the chart that's shown here is drawn from a study conducted by the University of Wisconsin Population Health Institute. And they looked at what drives health outcomes at a population level. So if you have two small cities and you compare them and the population in one is healthier than in the other, what are the underlying factors that have driven that outcome, that one population has better health than the other? And it's fascinating because one thing they found is that actual health care, so ability to access health care and the quality of that health care, only determines about 20% of the health outcome for a population, which was not intuitive, to me at least. The other 80% of factors that drive health outcomes, as shown on this chart, are things like socioeconomic factors, things like community safety, family and social support, education, health behaviors, so do people choose to use tobacco, do they engage in risky sexual health activities, do they abuse alcohol, and so on. And 10% is associated with the physical environment, so do they have safe housing, is the community infrastructure well maintained, and so forth. So you add that up, 80% of factors are actually things that are addressed by human services as opposed to by the healthcare system. And not surprisingly, we spoke with the chief medical officer of a large hospital in a very low-income area as part of this study, and he made exactly this point. He says he's trying to figure out how the hospital can improve the health of the population in the area that it exists within, but he feels like he's fighting a battle with one hand tied behind his back because by the time people get to the hospital, they can only impact that 20% of the health outcome that's associated with quality and access to care. 80% of what determines this person's health is stuff that's already happened, associated with, again, their employment, their tobacco use, the safety of their housing, and so forth. So it's a huge, huge connection between human services and health. And we see that internationally. If you look at OECD countries, they actually spend more on human services than they do on health care, and they get better health outcomes than the United States does. In the United States, it's the opposite. We spend significantly more on health care than we do on human services, and we spend more on health care than do other developed nations, but we end up with worse outcomes. And the argument is, in part, that's because of underinvestment in human services. And international comparisons are interesting, but obviously different countries are different for lots of different reasons. But the text at the bottom of this page also gives you some interesting findings from a study that was done domestically, just looking at the U.S. So a researcher at the Yale School of Public Health looked at U.S. states and looked at the relationship between how much is spent on human social spending, so human services related spending, relative to health spending within those states. And the finding was that those states in which there was more spending on human services had better health outcomes 2 years down the road. And those better health outcomes, are then associated with reduced need for expensive health care. So there's a direct flow through to the cost of health care. So very, very powerful relationships between human services and healthcare outcomes and healthcare spending. So that's great. We think it makes a very powerful argument for the potential of CBOs, but are CBOs really positioned to deliver on this potential? And unfortunately, the answer is that today they're not. They face some serious constraints on their effectiveness. In our written report, there's lots of detail on these factors beginning on page 31, but we wanted to highlight in particular some financial stresses. More than 10% of CBOs are actually technically insolvent. Their liabilities exceed their assets. And a really staggering figure for us, 30% have financial reserves that are equivalent to 1 month of expenses or less. And we looked at this across geographies, and we found it afflicted, those statistics were similar across geographies. We looked at it across sizes of CBOs, and we found that there were many severely stressed CBOs at both large and small, among both large and small CBOs. It really is a common finding across any population of CBOs. And when you think about an organization operating with less than 1 month of expenses in the bank, it means they're skating on very thin ice. So any unexpected financial event, their roof starts to leak and needs to be repaired, or a contract that they think they're going to win falls through and doesn't come through, it immediately places these CBOs in severe financial crisis because they've got payroll coming up in 2 weeks, 3 weeks, 4 weeks, and very possibly are going to struggle to meet that. That also means that those institutions have very limited capacity to think about building their own organizational capacity over time. You ask yourself, are they able to think about how to scale their business optimally? Are they able to plot a strategy for investing in IT infrastructure that will allow them to run their businesses efficiently over time? Are they able to think about innovating and developing innovative new service packages? Absolutely not. They're going to be focused on that next payroll, and they're not going to have either time or money to devote to longer-term strategic issues like that. And that's a real constraint on their long-term effectiveness, their long-term ability to realize the really incredible potential that we just described. So why do all these conditions exist at CBOs? There are lots of reasons, frankly, but a couple that we want to highlight. In the case of financial stress, certainly there are some practices within CBOs that we think contribute to financial stress. Many CBOs have not been able to invest in robust financial reporting systems or in risk management capabilities, and as a result, they don't actually have the tools to know if they're approaching a financial crisis or able to manage it when it does occur. We've also observed in many institutions a lack of commitment or insufficient commitment to building financial reserves and management infrastructure. And that sounds like a harsh criticism, but it's completely understandable. CBOs are mission-driven, by and large, and their missions are incredibly important. And in many cases, they face greater demand for services than they can meet today. And obviously, every dollar that they divert to build up their financial reserves is a dollar not spent providing services to clients who need them. And these clients really need them. So that's a very, very difficult choice, and many CBOs, in our observation, continue to prioritize mission as a result. But we do think it's absolutely critical that they balance that decision and also build long-term sustainability and stability. We also want to highlight as a cause of financial stress constraints that are imposed by contracting and grant practices, both on the part of government agencies and philanthropy. In particular, government contracts for human services are not typically what you would call cost-plus contracts. So a cost-plus contract is one where payment for a service equals the amount of money that it's going to require the provider of the service to spend, plus some margin. And in the case of government contracts for human services, they're really cost minus, meaning that the government agencies reimburse CBOs something less than the full cost of the services they provide, and CBOs are then expected to find charitable donations or other sources of funding to make up the difference. So government agencies buy services at a deep discount. As a matter of course, CBOs are left figuring out how to deal with that gap, and that really contributes a lot to the financial instability that we're discussing here. And it's a unique feature to how government agencies deal with CBOs. They are not imposing similar contract constraints on their contracts with commercial vendors, commercial for-profit vendors. And so we think that's very important to note. Moving on to operational shortcomings, we think there are a couple of things worth noting here. First is that the human services ecosystem tends to operate within pretty strong organizational silos, and those silos in many cases prevent government agencies and CBOs from sharing data with each other or from collaborating on important things like population needs assessments. It prevents CBOs from collaborating with each other to develop integrated packages of services to serve interdependent needs that exist within a population. And really we want to flag again the importance of data sharing, because a lot of the data associated with human services provision is very private in nature. It includes healthcare data that has regulatory constraints on its privacy, but it's really important that data be shared at some level so that outcomes can be tracked across CBOs and across time as service recipients age, move around the country, and pull down services from different providers. The third column that we wanted to highlight here as a driver or as a roadblock to realizing the full potential for CBOs is mistaken beliefs. And we've highlighted a couple of these in the discussion so far. Again, we tend to think of, or the public at least tends to think of CBOs as charities as opposed to complex operating organizations. It's also worth noting that government agencies in many cases tend to think of CBOs in a transactional manner as service providers. So a homeless shelter is viewed as a provider of a certain number of beds or a certain quantum of bed capacity. And that tends to impose a short-term view of their function. We really think that CBOs and agencies should develop a more strategic partnership-based approach in which they're really focused on how can this homeless shelter be viewed as a long-term solution to clients' housing needs, how can the government agency and the homeless shelter cooperate together to try to map out a transition to stable permanent housing for their clients, as opposed to just getting a night off the streets. But we don't think that model is quite there yet. I would also highlight again a lack of trust in some cases of human services stakeholders. Many government agency contracts with CBOs include very strict constraints and rules about how the funding can be spent, what portion needs to be spent on direct service provision, what can or cannot be spent on organizational capacity building, and so forth. And in our view, that really betrays a lack of trust of the CBOs themselves. Large CBOs, if they're well run, and if you believe they're well run, then we would argue that when you contract with them, you should trust them to make appropriate decisions about how to balance program spending versus organizational capacity building and the like. But that trust isn't quite there yet in many of the contracting arrangements that we've observed. And then lastly, in the fourth column, we wanted to note both talent and technology limitations that CBOs suffer from. The technology limitations are a direct outgrowth of the financial stresses and contracting processes that we've described previously. Many CBOs have just not been able to invest in robust IT and reporting infrastructures. They've also not been able to invest in things like technology-enabled remote delivery processes. And those constraints also kind of carry over to the human capital market and have impacted CBO's ability to pay for and therefore attract and retain talent who they compete with for-profit providers for in many cases. So it's a tough situation, we would say, that CBOs face with a lot of constraints on their ability to realize their full potential. And if we flip to the next page, we wanted to highlight what we view as 5, we're calling them North Star initiatives, and these are 5 really important imperatives that we are putting forward and recommending should be embraced by both CBOs and their partners in the human services ecosystem, both government agencies and philanthropists, in order to steer the CBO community towards a future in which it's better able to realize its full transformative potential. And those 5 North Stars are first, reiterating and deepening a commitment to outcomes. We believe that both agencies and CBOs themselves should be committed to allocating funding to programs that have proven positive outcomes over time, and that's going to require a lot of investment in data gathering, data management, data storage, as well as analytics to track those outcomes over time. It's also going to require a shift in operating procedures so that that information and that data can be shared across geographies, across programs, and across organizational silos. So people talk a lot about commitments. People are starting to measure them more, but we think there's a long way to go before there's really a widely held standard view of how to think about outcomes and how to measure them over time, and it won't be easy to get there. So that's North Star number 1. North Star number 2 is a commitment to developing capacity for innovation. And this is in some tension with the North Star number 1, a commitment to outcomes. We think that it's important to commit to investing in programs that have proven outcomes, but we also do think it's also important to commit to reserving a share of funding and a share of activity to invest in experimentation. Innovation is not something that's easy. It's not something that's easy to predict. And we think CBOs and government agencies should be experimenting, should be coming up with new delivery processes, new service packages, and the like. And many of those experiments will fail. And it's important for everyone to acknowledge that up front, that if you're trying to innovate, there's a high failure rate, and that's how you learn, and that's how you identify that subset of innovations that are positive and have good outcomes, and then you can double down on those. And so we think that's a cultural change and a funding change that, as we've said here, CBOs need to be allowed to fail forward, meaning try 10 things. 9 of them might fail, but if you identify a fantastic innovation with that 10th experiment, that's great, and then you can double down on that and go forward on that basis. Third North Star is something we're calling Operating Model 2.0, which transitioning to a more strategic partnership approach. And this has a couple of components to it. First, as noted here, we think CBOs and public agencies should be partnering together to develop solutions and to think about solutions for the populations that they serve. So CBOs shouldn't be interacting with government agencies just when they get an RFP that says, hey, we need this many beds of homeless shelter capacity for the next quarter, please submit your bids. CBOs and government agencies should be interacting with each other way before that and sitting down together to understand the dimensions of, in that example, a homelessness problem in a given population, and to think about different solutions for that over time. We also think that this implies, again, transitioning to a more partnership-based rather than a transactional procurement process. It's obviously important and fair for government agencies to consider cost of services in their procurement processes, but we think that a purely transactional procurement process that just goes out and procures services on a lowest cost bid basis really misses the point and misses the opportunity to think about developing strategic partnerships between CBOs and agencies over time. Fourth, North Star initiative is implementation of improved financial management policies and practices. This comes back to the point we were making earlier, that many CBOs have not yet been able to invest in strong finance and financial risk management capabilities, and we think it's important that they do so, even if that means making a hard choice about investing in long-term development of systems versus today investing in additional program capacity. We also think there's an important point here to be made about the public agencies and how they can make a change in order to improve financial situation and practices at CBOs. And that is, in short, to reform their contracting processes to make sure that they provide full and timely payment to the CBOs. So cost-minus contracts are never going to create a strong foundation for CBOs to be stable over time. We also have heard a lot of observations that the payment cycle associated with some public contracts is extremely long and lengthening, and that also creates a tremendous amount of cash flow pressure and uncertainty for CBOs, and we think that needs to be addressed, again, if they are to become stable, sustainable organizations who are able to reach their full potential over time. And then the last of the 5 North Stars we're calling regulatory modernization. CBOs face a very complex web of regulations which exist at the federal, state, and local level. In many cases, those regulations are outdated or duplicate each other, or frankly, just seem to impose a burden on the CBOs that isn't actually productive or doesn't relate well to the stated goal of the regulation. And as a consequence, CBOs spend a ton of their person hours on dealing with regulatory compliance rather than all the other important things they could be dealing with, like service delivery or organizational capacity building over time. So obviously, regulation is important and it can be good, but we think that the CBOs and the public agencies at different levels, again, federal, state, and local, should sit down together to examine the full web of regulation that currently impacts CBOs and to try to come to a joint view of where there are opportunities to either eliminate or simplify and streamline regulation. We think that could have a huge impact in terms of addressing the financial stress that CBOs face today. So those are the 5 North Star initiatives that are described in further detail in our report. And a lot of people who we've described those North Star initiatives to have said, yeah, that's great, but that's really ambitious. People have known about these problems for many years, and we've even talked about some of these solutions for many years. How the heck are we actually going to make this happen? and what, if these problems were going to get fixed, why do they still exist today? And we acknowledge that it's a challenge, but we also wanted to highlight on this last page the fact that these ideas are already working. They're already being implemented in pockets around the country. And we think that's really important. This study, at the end of the day, probably didn't identify too many things that are blindingly new. Many of these ideas, again, are familiar, but these ideas haven't yet realized their full potential. And so we think the challenge for CBOs and for government agencies together is to just pick up on these points of success where these ideas are already being implemented and figure out how to scale them, how to replicate them, so that 5 years down the road, rather than pointing to pockets of success, we can point to an entire transformation of the sector, and as a result, a transformation of the impact that the sector is having. And so just quickly to note a couple of the case studies that are highlighted on this page. Dakota County, Minnesota has made a tremendous amount of progress transitioning to more performance-based CBO contracts. They're building target outcomes into their budgeting and fund allocation process. CBOs are obviously lining up with that as well in order to win those contracts. And we think that the whole business system, in effect, within that county has made a tremendous strides towards becoming more outcome-oriented. If you think about innovation, we wanted to highlight Blue Meridian Partners, which is a fund which is making big, long-term bets on innovation. And we think it's really important. They are identifying programs that they think have the potential to have a transformative impact on the sector. And they're making these bets to help those organizations build capacity and scale. So they're not putting $200 million behind just service delivery. They're really saying, how do we take this organization and scale it, replicate it, make it bigger, make it so that it will be 10 times larger 5 years down the road and having 10 times the impact. And we think that's incredibly important. Third, if we think about different and more cooperative operating models, we wanted to highlight the Children's Home Society of Florida and Florida's Community Partnership Schools. Students in those schools are receiving integrated support packages, so they're getting services not from one CBO here and another CBO there, but rather they're getting a comprehensive package of services that have been designed as a comprehensive whole to meet their needs. And these programs and packages include health and wellness support, nutrition support, after-school programs, counseling, and so forth. And this is a huge partnership effort. It involves CBOs, it involves government agencies, it involves the school district, it involves health centers, and so forth. And we think that's a very powerful model for the future as well. Fourth, when we think about contracting and financial arrangements, we wanted to give a shout out to Montgomery County, Maryland, where they have revolutionized the way they calculate reimbursement rates and, importantly, how they cover indirect costs for CBOs. So they're kind of transitioning away from that cost-minus contracting model, very important. And then lastly, in terms of regulatory modernization, we wanted to highlight the experience of the Colorado Department of Human Services, where they launched a regulatory modernization program a few years back and managed to knock out 20% of state-level regulations targeted at CBOs. They also made some operating changes going forward so that CBOs are now more formally involved in the development process and evaluation process whenever there are changes considered to regulations or whenever they're thinking about introducing new regulations. So that's a much more productive and rational approach to regulation in our minds, and it's having some good outcomes. So again, we wanted to highlight these examples because we know it's easy to tear out your hair in frustration when you think about the enormity of the challenge sometimes, and when you think about the degree of change that's implied by the North Star initiatives that we described. But we're really inspired by examples like these highlighted on page 13, and others that are covered in our written report, that to us show that the biggest impediment at the end of the day to creating the change and driving the change that we've described, it really is collective will to act. This can work, it can happen, and we really just need to make it happen now. So that concludes our formal remarks. I'm going to pass it back to Tracy, and she can share some thoughts on what's next and also how you guys can help and get involved.
Great. Thank you so much, Dylan. Thanks for that very thorough look at the recommendations and, importantly, those kind of North Star initiatives. So just briefly, before we open it up for questions, I wanted to highlight to Dylan's point about what's the collective will here. So what's next, and how can all of us help move these recommendations forward? With the formal release of the report last week, we began our dissemination phase, and we've been asking our members and partners and media and colleagues to share the report with their respective networks and communities as far and wide as possible. And we've seen just a tremendous response to that request. We've been featured in more than a dozen news articles. The report and the study have been shared widely among organizations across both the Alliance Network and APHSA and many of our organizations that we work closely with. Colleagues such as Dan Cardinelli, who leads Independent Sector, and many of you may know, published a Q&A with Susan and myself, and this week we'll be speaking on the report at the Lutheran Services of America's CEO Academy. There are many other instances. I won't go into details on those about how it's being shared, but we just want to really show appreciation for folks who have helped disseminate the important study here and build the momentum so that we can create as much awareness first and then really move into that action phase of how we take these recommendations and create better opportunities to make sure that we're leveraging all that comes with the community-based human-serving organizations across the nation, and how we can lean into that through the public sector, through philanthropic support, and with many other partners in business and otherwise. The Alliance is going to be featuring the report at its Senior Leadership Conference in just a few weeks and at their national conference in the fall, both of which will be great opportunities for folks to hear more information and participate in conversations. At APHSA, we will highlight the report at our upcoming annual summit, which is in Arlington, Virginia in the first part of May 6th through 9th. So if you're participating there, look for opportunities to learn more and lean into the report. And then we're really trying to take this kind of opening up phase and get in front of key audiences and decision makers and influencers so we can begin to identify and capitalize on opportunities to collaborate and really move into the action phase. And so if any of you who are participating on the webinar today would like us to be part of any engagements that you're interested in sharing information about or getting involved actively in any aspect of this, please don't hesitate to reach out to Susan or myself or any of our team members. We'd love to be part of those conversations. So just one other thought, and then I'll turn it over to Rahana to walk us through some Q&A. But Susan and I, obviously believe very much in our respective networks that we need to align the findings and recommendations from this study to our own respective offerings. So one way we just highlighted is how we'll bring this forward in our annual events. But we're moving quickly in partnership with some other organizations, including, for example, Social Finance, an organization dedicated to mobilizing capital to drive social progress, in having conversations about actually developing a national laboratory for contracting and procurement reform, an area that you just heard from Dylan is really ripe for modernization and action. And so more to come, we hope, on that front as we look to secure funds and move that idea forward. I hope you can tell that we're really excited about the opportunities here, understanding that there's some lower hanging fruit here, and then there's some bigger initiatives that we really have to lean in and find the collective will to move forward. And I'd just like to thank everyone for taking the time to participate with us, and that will conclude our formal remarks, and I'll turn it over to Rihanna for any questions we may have.
Thanks, Tracy. Actually, this is Tim Kobeson again. We are now opening up the webinar for questions. Please submit those via the chat box. We do have a question from JP Nicolay. Given the number of CBOs, does consolidation make sense, and will donors force this trend?
Dylan, do you want to share what you found in the work in terms of a consolidation on the for-profit side as compared to consolidation
Sure.
in our sector?
Yeah, a couple observations. One is that we found that consolidating transactions are less common in the nonprofit world than they are in the for-profit world, for sure. So there is less of a history of M&A and consolidation in the nonprofit world. Second, we heard from a number of large, healthy CBOs that they are regularly approached by other CBOs who are asking, in effect, to be acquired. But in many cases, the transactions that are being proposed aren't feasible because that other CBO has faced a financial crisis and has held on too long. So that by the time they're actually reaching out and saying, hey, we're interested in merging with someone, they're in such bad financial condition and have so many piled up liabilities and debts that it's actually too damaging for the acquirer to acquire them. And that is something we've heard happen frequently. And so we think that that suggests that CBOs and their boards probably need to become better at realizing when they're heading into an unsustainable financial position, recognize that earlier. And we also think there needs to be a cultural change in how CBOs think, which is surviving at all costs and hanging on no matter what till the bitter end shouldn't necessarily be the goal. And if you think about the for-profit sector, startups and, frankly, companies at all levels don't necessarily plan on remaining independent forever. Many of them are started and have a life cycle, but with the recognition that at some point the best thing for their business, for their employees, for their customers is for them to be acquired by or merge with another institution. And those decisions are ideally driven by a view of shareholder value as opposed to a steadfast commitment to independence no matter what. And so we think that kind of cultural shift maybe has a little bit of a ways to go in terms of working its way into the nonprofit world.
A couple of things that I would additionally add to that is we are seeing organizations within geographic areas standing up back office utilities, something that the report specifically talks to. So while they may not be merging, they are merging common functions and creating those back office utilities. Just yesterday, as an example, I presented the report over in Minnesota for MAC, which is a consolidation of back office utility for a number of organizations in Minneapolis, St. Paul. The other thing we're seeing is more at the local level, where regional funders are starting to stand up merger and acquisition funding to help organizations hire the kind of due diligence capacities they're going to need to make a merger and acquisition happen. But there's a third thing that's starting to happen, which, again, the future is happening. It's just unevenly divided. And that is that we are starting to see within our network more strategic growth, that it isn't about somebody is small and they know they can't get to where they need to be, but it's where we have an organization who needs right now, in response to the opioid crisis, the need to expand their reach in substance abuse treatment and prevention, who are going now and finding good, strong organizations who they want to merge with in order for both of them to be stronger in meeting the needs of their states and being able to have a significant part of the market. So the strategic growth is something I think we're going to start seeing more of. I think it's very welcome. And the last thing I would just add, that in some of our small rural areas of the country, smaller organizations may be small by budget, but they are mighty in terms of what they are leveraging and creating within rural areas of our country that can be very remote for their citizens to have access to what they need. So that would just be a little bit of additional perspective.
Thank you both. JP has a second question. How will private sector be able to make up for what looks like an effort to hollow out federal agencies and funding?
Tracy, you want to grab that one?
Oh, you wanted to pass that one, didn't you?
I'll be happy to help.
Yeah, so I think there's a couple of things. I think one, that the uncertainty kind of at the national level and where those pieces are why the report is so important right now, to understand what can we do to leverage resources in some of the ways that Susan just talked about that are already happening on the ground, and fill that in. Where is philanthropy in part of this conversation, right? How do they help create some of the additional strength and bandwidth that we need, both in community-based organizations and in something like procurement and contracting reform, which really happens much more at a state or local level, in being able to think about how we finance and support efforts on the ground, knowing that there's likely to be some additional impacts that might come down from the federal level. But I think here the real focus is how do we lean in and create that really broad collaboration on the ground that enables both us to move forward when resources may be more or less, which is really, I think, the trend that we've been on for quite some time. So that isn't necessarily a new pressure. It just really culminates why understanding the financial health of the community-based organizations that are so central to the delivery of health and human services is important for everyone, including the public sector, to understand. And then really thinking about how leadership at county levels, city levels, and the state, in collaboration with philanthropy and with the private sector on the for-profit side and with community-based organizations, so that we leverage the talent and the importance that this sector already provides and really take it to its next level.
One of the things I would just add to that is we're very appreciative of the Administration for Children, Youth, and Families, Steve Wagner, the Interim Assistant Secretary, who has written a blog on this report and are helping to disseminate the report and wants to have Tracy and me come and present it to key leaders within Administration of Children, Youth, and Families. I think that's very good news. I think it's going to be very important, though, for us to get this in front of Congress. I encourage all of you on the phone to get this in front of your members of Congress, because they need to see and understand the larger role and value, both economically and socially, that our sector provides, and they need to see and understand the realities that we face, but with those realities there are solutions. So please, do all you can, as we will be doing, to get this in front of Congress. It's important to know that the loss of federal dollars in health and human services would indeed be catastrophic. There is no way for private funding to backfill the government funding that goes into health and human services and needs to go into health and human services as a moral imperative of our nation. So I would just say to everyone on this phone that is a part of the nonprofit human services sector, this is where our larger role comes in, and that paramount responsibility to advocacy comes in. We have to be the voice. We have to stand strong together. If you're a member of the Alliance, it's critically important that you be engaged in our policy work, because it is a larger moral question for our nation about our care for one another and about what it is to be a civil society. And I think this is where our sector has its larger imperative, and that is to be that voice and to provide the necessary advocacy to ensure that the partnership between government and communities does not get severed. So I really appreciate the question, and I think it's a very timely one.
Thank you, Susan and Tracy. JP, thank you for both of your questions. Much appreciated. Denise Harlow posed the question asking whether the North Stars, whether those were presented in a prioritized order.
Denise, they are not presented in a prioritized order. However, we had a summit in December that was made of about 65 people from across all field sectors and systems who looked at the embargo draft of the report and really gave us phenomenal feedback as we continued to tighten the report and its recommendations and thought about how we were going to move recommendations to action. One of the things that was consistent, though, is that while these are not prioritized, the one that everything else is interdependent upon is this commitment to outcomes. And I thought that was a very intuitive response from such a wide, diverse group of people. But I think what that's calling us to is something much bigger than just organizations and their own individual commitment to outcomes, but for leaders like Tracy and me and others to come together and say, United Way, and the list of who the partners need to be is exhaustive. Can we come to a common understanding of what the outcomes need to be and what the subset of core drivers of those outcomes are, so that we are more consistently measuring outcomes and not in the haphazard way in which it's happening today. So not prioritized, but that one seems to have an interdependence on the ability for the others to take hold.
Thank you, Denise, for your question. The next question is from Robert Schachter. How can these imperatives be moved forward at federal level in the current environment?
So this is Tracy. I think Susan just touched on this a little bit, but I do think that there are areas where there's a shared alignment, particularly in thinking about what might happen in county or local levels to really understand how do we get maximum impact, what are the kind of things that need to happen to make that happen, and so particularly within Health and Human Services and the Administration of Children and Families, we've had some early indications about a real alignment there, and I think opportunities. So while I know there's uncertainty and probably a lot of questions, I also think there's some areas that we can really lean in on, and that would be our hope to advance those conversations.
Yeah, I would agree. And I think we also have the opportunity with this report to frame this report in the context of things that are of interest out in D.C. And a couple of those things I think right now is when we think about the imperative of the larger ecosystem, what our nation faces in terms of human capital and our needs for human capital to meet the needs of our changing economy. When we look at the cost of the healthcare delivery system, the cost of corrections, and the role that our sector plays in those areas, and also the great interest that people have right now around regulatory relief on the for-profit side of the house, we need to bring our side of the house into that conversation as well. So I think we're just going to have to also look for the opportunities that fit with the priorities right now of this administration and Congress, and let them see that investing in this larger ecosystem and specifically in the roles and capacities, strengths, and viability of community-based organizations around the nation, who they are absolutely dependent upon to achieve those results, is critically important to the outcomes they're trying to achieve.
Thank you for your question, Robert. There are two questions from Lynn Iaquinta. Whether there's a media page that local presenters can use with appropriate slides. I can answer that. If you do go to alliance1.org, which is the Alliance's website, there is a toolkit available that you will find right from the homepage that does include a presentation with notes that we've pulled from this overall presentation that you can share in those settings in your communities, et cetera. And if you have any questions or follow-up, please don't hesitate to reach out to the Alliance and we'll follow up accordingly.
And if as you're working with what we have out there, there's more that you need, please communicate that with us. I mean, our biggest hope is that everybody on this call is going to become an owner of this report in your own right, and we'll be doing all that you can to not only disseminate it, but moving these recommendations to action within whatever is your sphere of influence. So please, if there's more that we could be putting out there that would be helpful, let us know.
Next question comes from Mariana Singh. Are there any bills or legislations being asked to be supported to help CBOs?
So Mariana, thank you very much for that question. At this point, we believe that that will come, and it will come by our attempts to move the recommendations to action, and where we'll do some mapping to see where the disconnects are. If those disconnects would require legislation, then yes, we would be working to build coalitions to advance legislation.
Thank you, Marianne. The last question that we have posted for today is from Joe Coletti. What kind of outreach are you planning for large donors and foundations to encourage their participation in carrying out the North Star ideas?
Thank you, Joe, very much. Any ideas you have, we appreciate. We are doing all we can right now to get in front of the associations and the places where large donors and foundations are at. And if you have any insights or suggestions with that, we'd be very appreciative. But we specifically had philanthropy involved with us in this report because we're hoping that they too are going to help us to get this in front of both regional foundations, United Ways, that's why we had United Way Worldwide on our National Advisory Council, but also the large national foundations. And so we're hoping to find the places where they tend to meet together and have opportunities to present there. Any help anyone can give us is appreciated.
Before we close, please note again that the final report and a toolkit of resources to announce the report and its findings to your media, colleagues, and networks can be found at allianceone.org. We will also follow up with an evaluation this afternoon as we value your feedback on today's presentation. Thank you for joining us, and have a wonderful afternoon.